Which incision do you most commonly use during a breast augmentation? So let's go over the options for incision placement for breast augmentation. There's an incision you can make along the border of the areola and the natural color of your chest wall or breast skin. You can do that along a kind of smile incision from what would be on a clock from 3 to 9 o'clock. You can go underneath the breast, called an inframammary incision. There are also sometimes where people go through the armpit. It's called a transaxillary incision. And there were even some instances where people have gone through the belly button, called a transumbilical breast augmentation. I've even put them through an abdominoplasty incision when I performed abdominoplasties. In general, the location of the incision or the use of one incision over another depends upon a number of factors, including the size of the areola, the shape of the breast, the volume of implant you want to put in. In general, I think I prefer to go periareolar if the woman has a large enough areola compared to the implant I'm putting in. Many times I will use an inframammary incision because their areola is too small or they want a very large implant. But in general, I usually prefer the periareolar incision. So I would say it's probably 70-30 where I use either the periareolar or inframammary. I don't like the transaxillary too much because it limits your exposure and there are other risks associated with it. And the tuba, the transumbilical, is an incision that is really just for saline implants in general.